Hi, everyone. I'm Monika Mitra, and I'm really honored to be here, so thanks for the invitation. And I want to thank Dr. Davis. She is a moderator extraordinaire. She really got us talking several times, and we had some really passionate discussions, so thank you. And before I begin, I have 3 disclaimers. One is I don't have any avatars or cartoons. I have been enjoying them throughout the day. I don't actually have a PowerPoint either. And the third disclaimer is I have never conducted a clinical trial, and I'm not a patient advocate. So why am I here then? So my message is simple. I'm here to speak about the inclusion of people with disabilities in clinical trials. And I'm here to talk about how can we use the principles of public health literacy to inform our research design so that we can include people with disabilities more effectively. So approximately 54 million people in the United States have a disability. And people with disabilities are a diverse group. They have different levels of functioning, different levels of needs, and they also represent a group that are likely to have more complex health conditions and chronic conditions over and above their disability and over and above their disabling condition. They live with a thinner margin of health and with high social risks. They're potentially one of the greatest beneficiaries of clinical trials and health services research. And they represent about 1/4 of health expenditures in the United States. They face significant health, social, and economic disparities. And in addition, they're a group that's traditionally marginalized and underrepresented, but in most research and policy settings, they are not recognized as a disparity group that is marginalized and underrepresented, and often not in the table. So you're not the only one. And this exclusion, this not being in the table, also applies to clinical trials research. And there are several ways in which this exclusion occurs, both in terms of explicit barriers, but also in terms of implicit barriers. So we know that clinical trials have favored healthy, young, non-disabled Caucasians, and this is primarily due to the strict inclusion and exclusion criteria. And we also know that about 59% of the US population are excluded from clinical trials because of these inclusion and exclusion criteria. So no doubt a considerable portion of this group that's excluded include people with disabilities, include children and adults with disabilities. So in 2014, Dr. Feldman and colleagues, they reviewed 300 randomized controlled clinical trials, and they looked at for the inclusion of people with intellectual disabilities specifically. And they found out of the 300, only 6, that's 2%, explicitly included people with intellectual disabilities. And they found that 15% explicitly excluded people with intellectual disabilities. But however, what is there between these 2 margins? And between the 2 margins are where the implicit barriers are. The implicit barriers of exclusion lie within these 2 margins, where they also found that 90% of the studies were actually designed in a way that excluded people with intellectual disabilities. And this includes these barriers, these implicit barriers include lack of community engagement, inaccessible materials, inaccessible information and recruitment, inadequate representation of people with disabilities, and the lack of knowledge and disability competence within the research community. And herein also lies, what Emma spoke about, is the implicit bias, and also the unfounded beliefs about the competency of people with disabilities in the research and in the medical community. And this is where lies the importance of health literacy, or a very holistic definition of health literacy. Unfortunately, there is a paucity of research, compounded with this is a paucity of research and limited understanding of what health literacy is within the context of people with disabilities. People with disabilities are often systematically excluded from current health literacy efforts, and this exclusion no doubt contributes to the ongoing health disparities and inequities among those who are disabled. So when framing health literacy in people with disabilities, we should think beyond accessible materials. We should think beyond inclusion and exclusion criteria. But we should think about the design and the implementation of the studies. We should think of the systemic barriers to communication and the facilitation of access and the meaningful engagement of the disabled communities. We should also think of understanding the socio-cultural context within which health literacy is experienced within the disability community. And this framing of health literacy is critical for people with disabilities and for other marginalized communities. And this is especially important for people with disabilities given the incredible mistrust of people with disabilities within the medical community, with the medical community. So then how do we structure clinical trials? How do we structure research through this broader lens of health literacy? So Williams and Moore in 2011 emphasized the need for universal research design, right? And which was later improved on by Dr. Diane Rios and her colleagues into accessible research design, which included the principles of universal research design, but went beyond it and included the need for accommodations, and then beyond that, they included the need for modifications. However, in order for us to effectively include people with disabilities, we need to think beyond universal design and accessibility. We need to think of inclusive and accessible research design. And inclusive and accessible research design should include the principles of universal design. It should include accommodations and include modifications. However, for this research to be effective, it needs to be founded in the principles of the disability rights mantra, which is nothing about us without us. The research needs to be inclusive of people with disabilities in the study design, in the recruitment strategies. It needs community buy-in, and I think someone mentioned, Chris Trudeau, you mentioned not just engagement of individual investigators with the community, but the institutional engagement, which I think is critical here. It needs to be conducted with people with disabilities and by people with disabilities. It needs to inform and educate researchers about the community. So it's not just about making the community literate, but it's about making the researchers literate as well about the community. And just in the same way, the community needs to be informed about the research. And most important, it needs to build trust and close this us and them divide with researchers on one side and the disability community on the other. Thank you.